Hello everybody, and welcome back to my channel. It's Mean, and this is another episode of Chow Buddies. Today we are talking about distemper. We're going to be covering what it is, the symptoms, and how to treat it. So if that sounds interesting, don't forget to like and subscribe so you never miss any future episodes. Let's get right into it. Distemper is a viral infection that can affect dogs, cats, ferrets, mink, foxes, wolves, coyotes, raccoons, otters, seals, and even humans. But today we are going to focus specifically on dogs because that is our area of expertise here at Chow Buddies. The virus that causes distemper is called Canine Distemper virus, or CDV, and it belongs to a group of viruses called the morbilliviruses. The other viruses in this group include measles virus, which infects humans, rinderpest virus, which infects cattle, Pest Day Petties ruminants virus, which infects goats and sheep, and Phocine distemper virus, which infects seals. Canine distemper virus is highly contagious and causes severe illness in unvaccinated dogs. Transmission occurs through direct contact with an infected dog, or indirectly through contact with contaminated surfaces or objects. The virus can survive in the environment for several weeks or months, and can be carried by insects such as ticks and mosquitoes. Infected dogs are most contagious during the first 3 to 4 weeks of illness, but some can shed the virus for up to 6 months. Clinical signs of distemper typically appear 1 to 2 weeks after infection and include high fever, cough, nasal discharge, vomiting, and diarrhea. As the disease progresses, the dog may develop neurological signs such as seizures, paralysis, and abnormal behavior. The case fatality rate in untreated dogs is approximately 50%. However, the prognosis for dogs that receive supportive care is much better. Treatment includes hospitalization, intravenous fluids, antibiotics to prevent secondary infections, anti-seizure medications, and nutritional support. Vaccines are available to prevent distemper and are typically given to puppies starting at 6 to 8 weeks of age. The symptoms of distemper can be varied and may include fever, cough, runny nose or eyes, sneezing, lethargy, loss of appetite, vomiting, diarrhea, seizures, twitching, paralysis, hyperactivity, aggression, biting, changes in behavior, blue gums, and difficulty breathing. Any dog can get distemper, but it is most common in puppies and dogs that have not been vaccinated. The incubation period for distemper is 1 to 2 weeks. This is the time from when a dog is exposed to the virus until the first signs of illness appear. During this time, the dog is contagious. The virus spreads through respiratory secretions, urine, feces, and milk. Dogs can also become infected by eating meat from infected animals. Once the dog is infected, the virus spreads to the lymph nodes where it replicates and then spreads to other parts of the body. The severity of the clinical signs depends on the dog's age and immune status. Puppies and dogs that have not been vaccinated are at the highest risk for developing severe clinical signs. Dogs with distemper are usually isolated and monitored closely for clinical signs. Treatment is supportive and includes intravenous fluids, antibiotics, anti-seizure medications, and nutritional support. The prognosis for dogs with distemper is guarded. The case fatality rate in untreated dogs is 50%. However, the prognosis for dogs that receive supportive care is much better. Here are some things to remember when caring for a dog with distemper. Monitor the dog closely for clinical signs. Provide supportive care, including intravenous fluids, antibiotics, and anti-seizure medications. Feed the dog a bland diet and monitor for vomiting or diarrhea. Restrict the dog's activity and keep it warm. If the dog has seizures, do not try to restrain it or give it any medication without consulting a veterinarian. If the dog goes into a coma, provide supportive care, including mechanical ventilation. The diagnosis of distemper is based on the dog's history, physical examination, and laboratory tests. There is no specific test to diagnose distemper. Laboratory tests may be performed to rule out other diseases. Treatment of distemper includes supportive care, such as intravenous fluids, antibiotics, and anti-seizure medications. In addition, The dog may need to be hospitalized for monitoring and isolation. The prognosis for dogs with distemper is guarded. The case fatality rate in untreated dogs is 50%. However, the prognosis for dogs that receive supportive care is much better. Here are some things that can be done at home to help a dog with distemper recover. Make sure the dog has access to plenty of fresh water. Feed the dog small amounts of food more frequently. Monitor the dog closely for vomiting or diarrhea. Restrict the dog's activity and keep it warm. If the dog has seizures, do not try to restrain it or give it any medication without consulting a veterinarian. Now that we've covered the basics of distemper, let's take a closer look at some of the symptoms. One of the first and most common symptoms of distemper is a high fever. A fever is the body's way of fighting off an infection. So, it is not uncommon for a dog with distemper to have a high temperature. The fever may be accompanied by other symptoms such as shivering, lethargy, and loss of appetite. Coughing and respiratory distress are also common in dogs with distemper. The virus can cause inflammation of the trachea and bronchi, which leads to coughing. In addition, the dog may have difficulty breathing due to the inflammation and fluid buildup in the lungs. Nasal discharge is another sign of distemper. The discharge may be clear, white, or yellow, and may be watery or thick and sticky. It is caused by inflammation of the nasal mucosa, which is the tissue that lines the nose. Other clinical signs of distemper include vomiting and diarrhea. These signs are caused by inflammation of the gastrointestinal tract. In severe cases, the vomiting and diarrhea may lead to dehydration and electrolyte imbalance. Seizures, twitching, and paralysis are neurological signs that can occur in dogs with distemper. The virus can cause inflammation of the brain and spinal cord, which leads to these signs. In some cases, the seizures may be followed by coma. So what should you do if you think your dog has distemper? If you notice any of these signs in your dog, it is important to take them to the vet right away. Early diagnosis and treatment can help improve your dog's prognosis. The sooner your dog gets treatment, the less likely they are to have complications from the disease. Don't delay seeking veterinary care because you think your dog will get better on its own. Distemper is a serious disease that can be fatal. With prompt veterinary care, many dogs with distemper make full recoveries. Is there anything you can do at home to help prevent your dog from getting distemper? Yes, there are a few things you can do to help protect your dog from distemper. First, make sure your dog is up to date on its vaccinations. The distemper vaccine is usually given to puppies starting at 6 to 8 weeks of age. Adult dogs should receive a booster shot every 1 to 3 years. In addition, avoid contact with sick dogs if possible. If you know a dog is sick with distemper, do not let your dog come into contact with it. And wash your hands thoroughly after being around sick dogs. There are some things you can do to help reduce your dog's risk of getting distemper. Keep your dog away from other dogs that may be infected with the virus. Vaccinate your dog against distemper. This is the best way to prevent the disease. Keep your dog's living area clean and disinfected. If your dog does get distemper, there is no specific cure for the disease, but supportive care can help your dog through it. This may involve hospitalization for fluid therapy and monitoring, as well as medications to help with symptoms like seizures. I hope you found this episode of Chow Buddies helpful and informative. If you have any questions or concerns, please reach out to your local veterinarian. And if you enjoyed this episode, don't forget to like and subscribe so you never miss an episode. Thanks for watching. See you next time.